sets of the DVDs and CDs, much more economical per session. There are some people that I want to acknowledge. One is the Granada Forum, a weekly radio show, granadaforum.com, Revolution Radio, have done a tremendous job at helping to promote this conference. I want to thank Roy of Hollywood KPFK for the time that he gives us every year. We were on there midnight Tuesday morning, and Rose Colombo gave us time yesterday morning, and so we're going to spend an hour and a half, almost 2 hours with Wendy at the Granada Forum. So we tremendously thank these people for what they've done for us. And again, on the granadaforum.com, Revolution Radio, click on that and get plugged into some of the things that certainly are coincidental with what we're doing. Harold, we're ready to go. Okay, ladies and gentlemen, welcome to the 42nd Annual Cancer Control Society Convention, Labor Day weekend 2014, Universal Sheraton Hotel, Universal City, California. We're very happy to have you, and our next presentation is going to be Dr. Javier Vasquez at the International BioCare Hospital. Dr. Vasquez has worked with Dr. Rodriguez for many years, both at implementing and developing the therapies. He has a complete staff, has a fully accredited hospital, and so we're very happy to have him, and he's going to be talking about cancer and other chronic diseases. Dr. Vasquez, thank you very much for being here.
Good afternoon, everybody. Thank you for being here. I'm Dr. Javier Vasquez. I'm attending physician at International BioCare Hospital and Medical Center. I wanted to thank the organization of the Cancer Control Society for the opportunity to participate again in this annual convention. I'm here to give you a general overview about our treatments based on integrated therapies to help cancer and non-cancer conditions and how to prevent it. But first, let me give you a very brief history about our hospital. ABC Hospital, a medical center, is located in Tijuana, Mexico. We are just 16 miles south from San Diego, California. Dr. Rodriguez is our medical director, and we're working for the last 38 years with integrated programs to help many diseases with a less toxic or invasive procedure. Once you are diagnosed with cancer, the first thing that happens is you will have a terrible fear, very unpredictable, treatments. You are going to be panicked, in other words. For this reason, it's very important to explore and research all options before making a decision. Take control. The choices, the decisions are yours. Make a team with your friends, with your medical doctor, and if you have any doubt, you can ask for a second opinion. Over the last 45 years, we have noticed that pollution, environmental changes, bad diet, radiation, etc., are contributing to a damage to the cells, a damage into the DNA. This damage eventually will produce abnormal cells. Can be a cancer cell, can be abnormal cells affecting your joints, affecting your bone marrow, producing arthritis, etc. We always say that cancer begins with ourselves because the way that we eat or lifestyle, when it's not right, will produce also damage. An immune dysfunction can also trigger cancer cells, or a genetic mutation can produce a cancer cell. A cancer suppressor gene damage, even stress or physical stress can be also a trigger factor. We know that 2 out of 3 families are affected by cancer, and 1 out of 3 individuals will be affected at some point by this dreadful disease. Cancer and cardiovascular diseases are the main killers, actually. And science blames the diet at least for 30% of the genetic disease, of the genetic changes. Cigarette smoke, active or passive, also contribute for another 30%. The main goal of our therapy is to restore biological conditions to levels prior to the onset of disease. In other words, we are going to reset our body computers in order that our internal organs, kidneys, liver, heart, can work much better and help us to eliminate toxins out of the body. And fight cancer without damage to normal cells and function. And actually, this is one of the biggest challenges we have now, to get a treatment that produces no side effects. It's our philosophy to understand that we don't have 2 patients alike. Every patient is different, and for this reason, we are going to make a custom-made program to our patients. In other words, it's like when you go to a store and you see a dress or a suit that you like it, not because you like it means that you are going to go and buy it immediately. You're going to go to the fitting room, you're going to put that suit, and then you will ask the tailor to make the proper adjustment. Exactly, we have to understand that we don't have 2 patients alike, and we are going to do individualized programs. One of the philosophy is that we are going to work with programs that do no harm, and number 2 is that we love our patients as we love ourselves. We have here an illustration on the screen that looks like a pyramid. We can understand that because at the bottom we can see little changes that we can do to maintain health, like clean air and water, nutrition, a good nutrition, exercise, rest and sleep, and management of stress. And as you can see, we can escalate in other things to maintain the health, like consuming digestive enzymes, using probiotics to stimulate the good flora, the use of enemas, and vitamins and supplements. The use of antioxidants, selenium, amino acids also are essential parts to build up our immune system, as well for liver protectors and even chelation therapy programs that will help us eliminate free radicals and improve the performance of our cardiovascular system. We have about immunostimulant, the use of stem cell therapy, the use of autologous dendritic cell vaccine, which is a custom-made vaccine, and specific therapies that I will talk about, such as whole body hyperthermia for cancer. The word wellness is something that we're using, and we need to be conscious that how important it is. The search of optimal functional and metabolic efficiency. Stay focused in natural remedies, good lifestyle. People should be educated and learn all about the different approaches to prevent and treat diseases early in life, not when it's too late. Being more a lifestyle than a remedy for something that could be avoided or prevented. Doctors should be taught to go beyond dispensing pills. The next revolution in medicine will be the regenerative area. Autologous factors such as platelet-rich plasma and autologous cell therapy will be the focus in modern medicine. I'd like to include this picture that I saw that makes very sense to me. I take metformin for the diabetes caused by the hydrochlorothiazide. I take for high blood pressure, which I got from the Ambien. I take for insomnia caused by the Xanax. I take for the anxiety that I got from Wellbutrin. I take for chronic fatigue, which I got from the Lipitor. I take because I have high cholesterol. Because a healthy diet and exercise with regular chiropractor care and superior nutritional supplements are just too much trouble. Preserve and restore. These are the goals, of our therapy. Nutrition as part of our therapies is very important. Our nutritional program is based on organic meals. We focus in oral and intravenous therapy. Intravenous because we understand that we have patients very ill from side effects from chemotherapy or radiation or because their conditions is very advanced. So what we can do when the patient checks in for treatment? We have to plan a treatment of intravenous therapy, total nutritional support, so the patient can have immediately all those nutrients into the bloodstream and can start healing right away. Detoxification, very important. The elimination of the toxins out of the body, the use of antioxidants to block the free radical activity, the use of enzymes and probiotics, management of stress, and rest. We do provide as well programs to help clean the colon and liver. We do programs of chelation to remove heavy metals out of the system. Or intravenous programs also will include high doses of vitamin C, glutathione, trace minerals, the use of laetrile therapy for cancer patients, and amino acids to help us build up the immune system. At admission time, most of our patients come with a diagnosis. When they check in for treatment, about 75% of our patients will tell me, Dr. Vasquez, I'm here because I have a breast cancer condition, I have a prostate cancer condition, I have a liver cancer condition. Another 25%, we don't know exactly the diagnosis. For this reason, it's very important to perform a complete medical interview, do a physical examination, review all medical records possible, including blood work, x-rays, etc., and update all the information with a new set of blood tests to compare and have a baseline where the patient is at the time to start the treatment. These blood work usually include a chemistry profile, a CBC, urine test, tumor markers, hormone panels. We have immune panels as well, and also panel for Epstein-Barr virus, Lyme disease, hepatitis C, etc. One of the tests that we perform at the clinic is the microscopic blood assessment. Nobody cares about these tests. They're very important. Why? Because doing this test is seen through a window, from your house window, and see how's the weather outside, so you can take preventive measures. In other words, if you're seeing that a cloud is coming and it's black, it means that you are going to have rain. So you can prevent that having an umbrella, raincoat before this strikes or hits your house. This information is for a normal patient, and at the left side we have the live cell analysis and the clot retraction test at the right. As you can see, most of the red blood cells are separate, and in the right side, the microscopic view of your blood seems even. This is a picture from a cancer patient in which we can see at the left your red blood cells clump. Why we don't like to see this? Because the red blood cells are responsible to carry oxygen into your system to accelerate the healing process. So for treatment, we focus and separate those red blood cells as an individual unit, so they can carry more oxygen and your body can be more alkaline. In the right side, you can see a lot of white spaces, which means toxicity, free radical activity. Antioxidants can help reverse this process, and we're doing that in our programs. What conditions we see the most? Basically, we can divide them into two main groups, malignant and non-malignant. As malignant, we're seeing basically all forms of cancers, being the most common breast cancer, lung cancer, colon cancer, pancreatic cancer, ovarian, lymphomas, brain tumors, and prostate cancer. In the non-malignant group, chronic fatigue syndrome, fibromyalgia, lupus, MS, arthritis, yeast problems, heart disease, hepatitis C, heavy metal toxicity. Fighting cancer is not easy. We have to combine with everything possible to restore the ability of your immune system to fight cancer. For this reason, we are going to use nutritional factors with known anti-cancer activity like vitamin A, vitamin C at high doses using 25 up to 50 grams, zinc, selenium, cesium. We're going to use a full intravenous nutrition, as I mentioned before, to help you replace all your nutrients that you require to heal in a fast way. We're going to use Laetrile, and Laetrile, as you know, is one of the most effective therapies for cancer that nature has to offer. Unfortunately, for regulations or standard medical programs, they like you to go through one route, which is the conventional program, using chemotherapy, radiation, and not seeing other alternative options. They will ask to check for this treatment once you are already down and with a lot of side effects from the conventional program, or when your doctor will tell you there is nothing else that I can do for you, go home and do whatever you want. So instead of recommending an integrated program that usually works the best, they will try to send you for the one-way route without any alternative. I mentioned that oxidative agents like ozone and ultraviolet blood irradiation are effective as well to reverse the inflammatory process and to help bring a more alkaline environment into your body. Hyperbaric oxygen treatment is part of our therapy that also helps to improve your alkaline environment. Fighting cancer is very important because we care a lot about your immune system. We have developed a program of dendritic cell vaccine, which is a custom-made vaccine obtained from your natural killer cells, in which we are going to send to a lab to stimulate them, like when we send a group of soldiers, when we don't have the budget to send all of them for special training, and when we have a very terrible enemy, we are going to send them to get that training, and once they come back from the training camp, they will pass information to the rest of the white cells and will tell them, hey guys, I just came from that training and I know what is the most weak point of this cancer. We are going to use this shortcut, we are going to use this weapon, and then the information will pass one white cell to the other. This is the function of the dendritic cell vaccine Also, we're going to use concentrated white blood cell products and the use of stem cell therapy as our regenerative program to the damaged cells. We do have as well whole body hyperthermia. The whole body hyperthermia is one of the protocols that is being used in most forms of cancer protocols in these days. Whole body hyperthermia is a form of treatment in which your temperature will be raised from 98 degrees to 107 Fahrenheit degrees. Selectively kills heat-sensitive malignant cells, increases response to other alternative treatments, and also is recommended for other infectious diseases like Lyme disease, hepatitis C, even an HIV. It can be used in combination with low-dose chemotherapy. First of all, we have to remember that fever is a natural response of our body to fight disease. When you get a cold or a pneumonia or intestinal infection, what happens? Your body produces fever because it's a way that tries to protect you, to defend you. So by creating an adverse environment with high temperature, cancer cells will suffer definitely a damage. And one of your questions can be why the normal cells cannot be affected. Because when you go to a sauna or steam bath, what happens? Your pores will open to allow perspiration to go out and refresh your body. But once you leave that sauna or steam bath, pores will be closed because there is no need to produce more sweat. This is a normal phenomena in the normal cells called vasodilatation. Expands under heat, but closes when you're not under that heat. Cancer cells, since they're very mature in the membrane walls, cannot do that. So once you expose a cancer cell to high temperature, and on top of that, you can use 1/10 or 1/15 of some form of gentle low-dose chemotherapy, you can have 100% response without having the side effects from that chemo. Also, we can use it in combination with insulin that enhances the cancer cell destruction. Whole body hyperthermia works with a high liposomal activity that promotes microbial cell destruction, increases phagocytic and killer cell activity, and also enhances effects from other therapies. One of the programs that we're using, not just for cancer, because again, we just not treat just cancer, we treat also chronic degenerative diseases, is the use of chelation therapy. Chelation therapy helps us to remove artery deposits like plaque, removes heavy metals, improves your circulation, especially microcirculation. And for this reason, is recommended in patients with diabetes, neuropathy, strokes, or just for prevention. If you know that you have been exposed to heavy metals, not having the right diet, or if you're in your family, you have a lot of background of cardiovascular disease, chelation therapy is well recommended. The use of stem cell therapy. The stem cell therapy can be obtained from peripheral blood, from bone marrow, or from the fat. It's called mesenchymal stem cells. It's used for many degenerative diseases like multiple sclerosis, ALS, muscular dystrophies, diabetes, Parkinson's, lupus, kidney disease, kidney failure, rheumatoid arthritis, spinal cord injuries, strokes. The stem cell therapy programs are basically known as autologous adult stem cells in which the donor and recipient is the same individual, or when we have, or when the patient is not able to have his own stem cells because he has severe bone marrow affection, obviously he cannot produce a high quality stem cells, then we call them allogenic adult stem cells, in which the donor can be a sibling who share father and mother, so can be biomatching compatible. Blood compatibility, the absence of transferable diseases, and in good health are the basic requirements. Autologous stem cells, progenitor cells, means the use of no-embryonic tissues, no tumorigenic risks, no blood-borne disease, donor-recipient matching not required, rejection of grafted cells is not existent, and equal efficacy in chronic degenerative disease. When surgical approach is required, our hospital is equipped with all lines of the specialties on board, cardiology, pneumology, internal medicine, and also surgical area. When a tumor is limited to a single area that can be potentially curable, or when we have a patient that comes with a tumor that is threatening the life, blocking the airways or the intestine, obviously we're not going to wait 3 weeks until the effect of lateral takes place. We have to do something immediately. Or when the condition is no longer possible to be treated with medication, like the case of large hiatal hernias, large herniated discs with nerve compression. Always, we are focusing in prevention as well. We know that we have available a different line of products like vitamin C, antioxidants, digestive enzymes, trace minerals that will support our immune system. So as well, we do have programs that can help you prevent disease. Preventive and anti-aging. Preventive medicine are immune-enhancing programs that to give longer and more healthful living and joyful life. Healthy diet and supplements, and the use of stem cell therapy to help you detox and support your immune system. The foundation of prevention is based on enzymes and antioxidants, and in summary, at IDC, we have a comprehensive implementation of integrated programs individualized according to the patient's needs in an all-inclusive in-house program that will lead to the best possible positive results. At International BioCare, we do have the experience, the track record, first-class bilingual staff, and what is more important, we offer results. In these times, we're facing new challenges to our health with increasing environmental pollution, radiation stress, and not exactly a healthy diet that result in an increase of cancer and degenerative diseases. It is in our hands to initiate a change in our lifestyle to improve this. We must be partakers of this change, teaching our friends and our relatives that prevention is possible. I deeply thank you for your kind assistance in this presentation. Have a good evening and the very best to all of you.
Your booth is in 402 behind the ballroom here in the other room. In just about 2 minutes. If you want to, if there's anybody that would like to, if you want to stand up, please feel free to stand up. Just don't go anywhere. And we'll get our equipment changed as quickly as we can. And Dr. Vasquez will be at his booth. I think he mentioned about Laetrile. I suspect our next speaker may mention it as well. And again, if you get doctorate results by Ralph Moss, you will see good science, bad politics. Monday, tomorrow, I believe, it's Nick Griffin will be speaking. Also, he's done a lot of work in the area of good science and nefarious politics. So we do have that. We will be presenting those things this weekend. Once again, I have a request to say a few words more about the tour, and particularly while we're changing some of this equipment. Some people may be under the impression that Tijuana is a dangerous place to visit. And I don't know how many here, if you've been on the tour, you probably know that that's not quite true. And if you live in Los Angeles or Chicago or Detroit or New York or Washington, D.C., your chances, in my opinion, of getting mugged, killed, robbed, whatever, is probably a million times more than if you happen to be visiting or living in Tijuana. And at the height of the so-called, what our media call the drug wars in Tijuana, left the overwhelming majority of people untouched. Drug cartels in Mexico, just the way drug cartels, gangbangers in the United States do some horrible things. Most of the time they do it to each other. Sometimes they do it to innocent people and bystanders. But by and large, Tijuana is a very safe place to visit. And over 40 years going to Tijuana, spending days, weeks in Tijuana, I've never had an experience where I felt afraid or threatened. And at the various clinics, when I've been down there visiting, I've seen single women come from Europe, many states in the United States, by themselves to visit, to get treated at the clinics in Tijuana. So again, if you check with the registration desk, you can register for the Wednesday tour. We will visit 5 of the clinics down there in a given day. You get to see the clinic, you get to see the doctors, you get to see the patients, and they're very generous with snacks and food. We will have lunch at one of those particular clinics. I'm not sure yet exactly which one, but we will. Again, nurses, dentists, get continuing education, and if you're, particularly if you're in another discipline, another certificate that issues credit, check with your board and see if there's reciprocity with the 2 boards in California. And we have heard from people that have been on the tour from other states that do receive credit, even though they may not be a nurse or dentist, or they may be a nurse or dentist in those states, and there is reciprocity in many cases. So that, again, it's a very interesting continuing education class, or it can be a life-saving tour to find out how to get treated. And all set? Okay, Harold, we're about ready. Good afternoon, ladies and gentlemen. Pleasure to have you with us. 42nd Annual Cancer Control Society Convention, Labor Day weekend 2014, Sheraton Universal Hotel in Universal City, California. Our next presentation is, of course, Dr. Contreras, Francisco Contreras, the youngest son of Ernesto Contreras Sr., who started this movement, close to 50 years ago, in Tijuana, and been a part of that growth. Dr. Contreras studied medicine, did postgraduate work in Austria, and then, of course, has come back to operate the facility founded by his late father. Pleasure to have you here, as always. Look forward to many more years.
Good afternoon. It's a pleasure to be with you this afternoon. Who's been here before, last year?
So most of you. Well, I want to talk to you about a few new things that are happening in the world of cancer, and how in the alternative world we can take advantage of that. A few months ago, I was invited to participate in a panel of oncologists from California, and I was the only oncologist from Mexico, to present the case of alternative therapy to the state representatives. It was a very interesting meeting. There was 3 oncologists from San Diego and myself, and I was left to talk at the end on the war on cancer. And these oncologists were driving the point that in Mexico and in many parts of the world that alternative medicine is being presented or administered to patients, that we have no clue what we do. And that it has to be evidence-based medicine. And they were talking about all of the new things and how many publications have come about. And I was just listening to them. And when my time came, I told them what George Orwell said. In times of universal deceit, telling the truth becomes a revolutionary act. And the truth is that in most of the world, outside of the States, and not even in the States a lot of times, and in Europe, it's existence-based medicine. Whatever we have at hand. We don't have the resources in Mexico that you have in the States, and so we have to deal with that. And so it cannot be just evidence-based. And I was letting them know that even though there's been great advantage, and there's no question about it, that molecular biology is bringing many things into the table. And nowadays, the big thing is the genetic entity of cancer and how gene mutations impact a cancer and makes it work. And so they've developed this way of targeting tumors in a very specific way, in a very personalized way. So through the Cancer Genome Atlas and the Cancer Genome Characterization Initiative, now they're targeting therapies, and TARGET stands for Therapeutically Applicable Research to generate effective treatment. I love Americans, how they come up with these target therapies. And so with this, you will find out the mutations that make the wrong proteins. Then they try it in animals how to block those proteins, and those are the targets, and that way you treat cancer. And all of this is done with what is called signaling transduction, okay? We actually change the science in a metabolic pathway so that the cell cannot produce those proteins that are absolutely necessary for the tumor to grow. This is very interesting. And the first drug that was approved with this system was in 2001, called Gleevec, for chromosome 22 positive chronic leukemias. And what happens is that in chromosome 9 and chromosome 2, there's a translocation of certain genes, and it becomes what we know as Philadelphia chromosome. And Philadelphia chromosome is the culprit or the cause of the production of certain enzymes, tyrosine kinase enzymes, and these enzymes are very bad for us, and they generate the production of blasts or of cancer cells in the bloodstream. And so with signaling transduction, they invented this imatinib or Gleevec, which is a tyrosine kinase inhibiting agent. And when you give this, that production of that enzyme stops and the tumor goes away. And it works for only chromosome positive or Philadelphia positive chronic myelogenous leukemia. For any other type of leukemia, it doesn't work. You have to have that. So it's very targeted. The problem is that even though this is a beautiful study, is that, for instance, these are the possible mutations just for cancer of the breast. Thousands of mutations. And so you would have to develop a monoclonal antigen for each one of those mutations. And that was cancer regress. If you look at all of the cancers, it's really millions of mutations. What happens here is that one mutation can affect another gene. These are the sequences that are affected and the proteins that can be produced. So if you want to be really personal and a patient has, let's say, 2,000 mutations, you would need 2,000 monoclonal antigens. And the average cost of a monoclonal antigen is $10,000 a month. And they usually work for 4 months. I had a patient tell me, you know, that they're telling me to do this, I have no insurance, so the therapy would cost me $40,000 because they gave me 4 months to live. And he said, I decided to go and spend the $40,000 in Cancun. He lived for a whole year and still left money behind. That's how practical this is, you know. So I was telling these oncologists, this is, you know, a daunting challenge, and it brings nothing. The first drug to be approved was in 2001. Here we are at 2014, and we have nothing to show for it. So the only evidence that you have of your medicine is that it doesn't work. How do I know this? Very simple. Every year, more people are dying of cancer. And those are the facts. So we need to do something different, I told them. And then I aimed my talk to the politicians. And I told them, you know, these guys are bright, they're very intelligent, they're very committed, and they have all kinds of resources to play around and fool around with all of these toys. But the problem is not a technical problem. The reason why there's no results is because of their philosophy. So at the Oasis of Hope, what we're doing is that instead of looking for so many genetic differences, we are attacking really what I'm calling the common metabolic traits of cancer. There are some common denominators in cancer that no matter how many thousands of genetic mutations a cancer may have, different from another, they all need the same source of energy. And it's sugar. We know that since 1930. So, and one of the ways that we know this now that's very easy to understand are the PET scans. In order for you to do a PET scan, they inject you with a sugar. And that sugar is uptaken by the tumor, and because of that uptake, the tumor actually lights up. This is a patient with a tumor of the breast, and the sugar has been uptaken by the patient, and then the scan picks it up. This is a cancer of the breast. This is a cancer of the colon. Very different cancers. They both need the same sugar. And you see sarcomas and you see melanomas. It doesn't matter what type of tumor, you see it the same. So why don't we go for the source of energy? And there are many ways to attack the source of energy of cancer. Another common denominator is inflammation. And there are many signaling pathways to stop NF-kappa B. And there are many nutrients that do exactly the same as some of the monoclonal antigens that cost $10,000 a month for, you know, a few pennies a day. And they do exactly the same. The reason they didn't go through the FDA is because they cannot be patented. But it's been proven to do the same thing. So there's other proteins that are very necessary for tumors to grow. So insulin, ILGF1, and VEGF. These are proteins that also you can use signaling transduction to block them. And again, most of the things that we use are foods, are completely natural elements that are going to stop the production of those. Another thing that is common to all tumors is their convoluted vasculature. And so normal tissue has very beautiful free-flowing vessels, whereas tumors have very convoluted and leaky vessels. And that's why, for instance, hypothermia works, because these vessels cannot disperse heat. And so the tumors are extremely heated, whereas normal cells can get rid of the heat. And that's why they can die. At low temperatures, that was mentioned here before, hypothermia also can be very immune stimulating. So that's another way to use hyperthermia. And the other one, as it was mentioned also, is to potentialize the use of other anti-tumor agents like chemo, vitamin C, later. So as I told these people, what's important is that we change our philosophy in how we view cancer, and the reason for the failure is not technical but philosophical. So at the Oasis of Hope, instead of concentrating on the tumor, because everything that's been done to date has been to study the tumor and never study the patient. For instance, 90% to 95% of the money goes to study primary tumors. And I have not seen one patient die of a primary tumor. The patients always die being complicated by secondary tumors or the metastases. And there's only 5 to 10% of the money spent on studying metastases. So you spend very little money on what kills the patient and spend all of your money on what doesn't kill the patient. That's a big problem that needs to change just philosophically. And so our philosophy is based on two principles. The first one is by what Hippocrates said, primum est nihil nocere, or first, not to harm. And then what Jesus said, love your neighbor, says the Bible, but we say love your patient as you love yourself. If you truly do that, there's a lot of things that you're not going to do to your patient that you otherwise do. There's a study that shows that very few oncologists would ever touch chemotherapy because we have inside information for ourselves. We would use it on the patients all day long, but if we have developed cancer, we don't use it. That shows you how bad it is. And the other thing is that they measure results on what happens to the tumor. And so that's why you read about all of these successes, because tumors are being destroyed right and left. But what happens to the patient? They die. So the therapy is very effective. It destroys the tumor, but the patient dies. So that's what I call a successful failure. I'd rather have a therapy that doesn't destroy the tumor and keeps my patient alive. And so that's what alternative therapies a lot of times will achieve. And so I love to call that failed successes. You know, if an oncologist looks at you and says, well, what happened to your tumor? Still there? Well, you're a failure. Well, I'm alive, man. So that's what needs to change, that we can convert a malignancy into a chronic disease where a patient can live for a very, very long time with quality of life. So the Oasis of Hope is an integrative oncology center that is holistic. We very much include in our therapies the needs of the patients as far as the emotions and spiritual are concerned, so we provide them with emotional and spiritual support. Eclectic, we have never said that all conventional methods are wrong and that they cannot help. Many times they do help, many times they're very necessary, and we combine them. It's personalized, it will depend on the needs of every patient. And it's permanent. That's the beauty of alternative therapies. Chemotherapy can be very effective for a while, but then it's so toxic that you cannot continue with it, whereas alternative therapies can be taken for years and years and years. And then it's very dynamic because information is coming out on a daily basis, and there's many things that we can implement if we know about them to our therapies. So our therapies are designed with state-of-the-art research, and we've treated over 100,000 people with it in the last 50 years with what we call the Contreras metabolic integrative approach. Because the metabolism of all tumors, as I mentioned before, is the same. So it's much easier to go for the common denominators than for the genetic changes. And let me just give you a few examples. This is a patient that was sent home to die with a very large ovarian tumor. She looked like she was 11 months pregnant, and we were able to reduce the tumor by about 40%, and then, you know, the patient decided, well, it's time for Bobby. She called her tumor Bobby. It's time for Bobby to get out, to be out. So we did the surgery. This is Bobby coming out, weighed 11 pounds. So we combined this in this patient, low-dose chemo surgery and alternative therapies. This was about 7, 8 years ago. She's still alive, completely tumor-free. There's another patient with cancer of the breast with large metastases to the liver. This is an enormous metastasis. We started therapy May 2006. By 2007, you can see that there's only a few scar tissue or lesions there. She's still alive today, doing great with this therapy. This is a patient that just came. I don't know if you can see the dates. He came in January. He had an embolism with chemotherapy, and when they were going to do another one, they found, hundreds of little tumors. You go further down, hundreds of tumors. We started the therapy at the CMIT, the Contreras Metabolic Integrative Therapy, and now you see maybe 1 or 2, maybe 3 lesions there, but further down the liver, nothing. About 95% of the tumors are gone from January to now. He's doing great. He was sent home to die in January, and now he's just enjoying life, doing very well. But 1 or 2 cases everybody has, even if you use water. So the important thing is what happens when you have groups of patients and you want to build statistics. And in stage 4 breast cancer, when the patients come to us urgent to treatment, that's our first option. On our first year, all of our patients are alive. And on our 5th year, our 5-year survival rate is 3 times higher than the U.S. national average as per the NIH or NCI. In breast cancer, when they already received chemotherapy and then come to us once they sent them home to die, 92% of our patients are still alive after the first year, and at 5 years, we still have twice as much or 2 times higher than the national average. And so these are patients that were virtually saved. In colorectal cancer, again, at the 5-year survival rate, twice the national average. In cancer of the ovary, 3 times the U.S. national average, and in cancer of the lung, which is the #1 killer in men and women, 5 times higher than the U.S. national average. So we have been able to prove, without a doubt, that our Contreras Metabolic Integrative approach is very, very effective. I would like to ask one of our patients that she's now 26, 27 years since she was also sent home to die with breast cancer. Burga Ratti is her name. And I would love for her to give her testimony. And if we have time at the end, I will answer some questions. Please go ahead. Welcome.
Thank you, Dr. Contreras, for your nice words. When I saw you a week ago in Tijuana, I did not know I would see you today again here so soon. I'm Burga Ratti, and I'm so blessed to be here today and share my rough draft with you. I got about 5 minutes, correct? In spring of 1987, my dear mother had lost her battle with breast cancer. In summer of 1987, after my daughter had just turned 11 years old, my gynecologist gave us the great news to look forward to a new baby, and we were really thrilled. However, this happiness followed within short minutes by a big shadow. There was a suspicion of breast cancer. 2 days later, the suspicion was confirmed during a biopsy while removing some breast tissue. My oncologist in Denver, Colorado, that's where we lived at that time, was very concerned. He told us, in order to save my own life, I needed to have first the abortion, second the mastectomy, third the radiation, and fourth chemotherapy. He explained to me that if I did not follow this treatment plan, the cancer would come back within 24 months and I would die from it. It was devastating news. I needed time to think. I'm still shaking. During the next few weeks, we experienced a huge challenge. Multiple visits to the oncologist asking more questions. Our minds were spinning. Our days and nights were full of fear about the future. Thinking about keep the baby, not keep the baby, keep the baby, not keep the baby. In the meantime, more surgery showed that the cancer had spread to the lymph nodes. Although I accepted the diagnosis, I could not accept the horrible prognosis. We were looking and researching to find less aggressive treatment plans. And one night, my prayers for guidance were answered. The decision to keep the baby was made. No abortion. Oh, we went to the university hospital to give the oncologist our decision. No abortion, no mastectomy, no radiation, no chemotherapy. He was shocked, to say the least. He could not believe what he had heard. He did, however, offer to be there for me during my journey, and he was helping me over many years, even though I did it my way. Looking for a holistic approach, we remember that years before, we had heard the late Dr. Ernesto Contreras, Sr. at a health convention in Arizona. We liked him right away, and his approach to cancer made sense to us. So I called him and gave him the insight of my situation and asked for his advice. His response was very uplifting. We agreed to come to Tijuana after the baby was born and start the metabolic therapy. However, new challenges became part of our life. There was a period of 21 months, starting in '87, where I had 10 surgical procedures, plus giving birth to a healthy, big vegetarian baby boy of almost 10 pounds. The first few times, our whole family, including the baby, went to the Oasis of Hope Hospital for ongoing treatments. In 1989, the cancer did come back, giving more challenges. During these years and up to today, I've been going to Tijuana and have been following the Contreras Integrative Metabolic Therapy for 25 plus years. Even though, throughout the years, there have been 6 cancer setbacks, I have never doubted the therapy. I am a fan of the nutritional therapy with lots of fruits and veggies, and I believe wholeheartedly that the Contreras approach of treating the whole person, body, mind, and spirit is the only way to go. I have now been living with stage 4 cancer for 14 years. And I'm so grateful that God has extended my time here on this planet and to share my story of hope with people like you. I am grateful for the support of my family during these long struggles, and I'm grateful to have been able to come back to the Oasis of Hope to see the beautiful, loving team, enjoy the great food, and to get my supply of health-promoting nutraceuticals. So thank you, Dr. Contreras, for helping so many people on the road to better health. You do a great job. In closing, I'd like to add, I don't take health for granted, and please don't take it either. And remember, cancer is costly, prevention is not. I also invite you to visit my health management website at www.wahema.de. That's WAHEMA.de, and click on the top right flag for English. God bless you all.
If you have any questions, I'll be happy to answer them.
Probably time for one.
They were so shocked by the questions.
While you're thinking about talking.
What is my booth? 103, and I have some books there available for you.
Before you go, I wanted to just interject a comment here. She talked about 6 setbacks, cancer setbacks in 25 years. Is there a single conventional oncologist in the United States that can match in his successful failures 6 setbacks over 25 years? Where deliver a healthy baby, live a relatively normal life, family and friends, for 25 years, and who knows how many more she has.
Yes, her whole life ahead.
Me,
Thank you very much.
thank you. Thank you very much for sharing that story. It's truly amazing when doctors tell you, if you don't do this, you're going to be dead. Sometimes they'll give you a time frame, and in case these doctors don't know, death is part of life. There's a timeline. We have a beginning and we have an end. So it's no news. We're going to die. But what we still have the choice in the United States, at least if we're 18 or older, is how we're going to live and how we're going to treat ourselves. With our children, we don't have that choice. We'll save that for another time and get into that issue. But what a remarkable story. She lived over 25 years. They were going to kill her baby. They were going to kill her in a relatively short period of time. Because she had a breast cancer. And she's still here. So it's truly amazing. Just before we introduce our next speaker, if you look at the program and you look at your watch or clock or clock on itself, we are running a little bit late. We are going to get every presentation in. We're going to give every presenter the time. After the dinner hour, we do have a couple of videos, and we'll tell you about those before we go. But in the meantime, I want to thank you for your patience, indulgence, and the other thing is for controlling the noise on your cell phones. We've had very few go off in opportune time, and really I want to thank you for that. Harold, I think we're ready to go. So as soon as we get the sign from the video people. Ladies and gentlemen, it's a real pleasure to invite our next guest back to this stage at the 42nd Annual Cancer Control Society Convention, Labor Day weekend 2014, Universal Sheraton Hotel in Universal City. Dr. Brad Weeks has been a while, but always happy to have him. One of the interesting things, he happens to be a board-certified psychiatrist. We have a number of other people in this movement that board-certified psychiatrists that know both sides of the medical spectrum. He's very often a presenter at the professional conferences, and yet we like him because he can also take those concepts and talk to them and explain them to everybody. We've heard a lot about inflammation to cancer, so it's a real pleasure and privilege to have Dr. Weeks here with us. Thank you.
It's my pleasure to be here. Thank you, Lorraine, wherever you are, 42 years, that's a long time to be serving her fellow human beings. Frank, thanks for your help. All right, yeah, Lorraine. Well, I'm going to be talking about inflammation and cancer today, and I hope I'm going to be surprising you a little bit. This is maybe going to surprise you. Chuck, are we okay? I have been surprised before. Chuck, shall I do anything on this, or should I just keep going? I'm seeing it on your computer, but not up front. By the way, Chuck, thank you very much for making it all happen. I love it. while I've got your attention and Chuck is fixing this, I'm going to pretend to take a call from somebody with my cell phone and with my handset. Because you all know that when you activate your cell phone, if you look at page 4 of the iPhone 4 manual, it says you should never have it on and closer than 5/8 of an inch to your body. Because they know this is a very dangerous instrument. So please don't put this up to your head when it's on. Yeah. So, yeah. So I gave a lecture recently in Japan on cancer after Fukushima, and I tried to clarify that it's one thing to help everyone who's been battling the Fukushima radiation. It's another thing to let all the kids be doing this all day long. Yes. All right. Thank you very much, guys. All right. Sorry for that delay. Inflammation and cancer is my topic. The bottom line is that inflammation is both good and bad. We're going to come back to that. This is a nice graphic of how popular this Cancer Control Society has been. Here's a grandma trying to get in, and there's no more room. It's too popular a movement, thanks to Lorraine and company. This was on this morning's Wall Street Journal. Doctors are unhappy, and it's hurting the patients. Why are doctors unhappy? Doctors are unhappy in part because, especially if you're in oncology, you're not really helping people. You might be well-intended, but you're not really helping people. A couple years ago when I gave a talk here, I asked for a show of hands of everyone who knows someone who's died of cancer. Can we do that again? Show of hands. And of course, you're all being fooled because you don't know. God bless the deceased. God bless the suffering. You don't know whether the cancer killed the person or the chemo and radiation. And it's very, very clear, if you're thinking scientifically, you can't separate the illness from the very dangerous treatment. When you look at the research, most people are clear that radiation and chemo are more dangerous than cancer. I'm not going to make that the topic here, but I want you to know that cancer is not a happy thing for people to be dealing with because the treatments are ineffective. There's other helping professions out there. Here's a gentleman at the Burlington, Vermont airport. I saw this poster. Here's a shoe shine guy who donated $100,000 in tips to kids. I just thought this was wonderful. You don't have to be a doctor to help people. And if you're going to be a doctor, you ought to focus on helping people and not just on helping big pharma. So we're thinking outside the box today. I like this graphic. This fellow was asked whether he's drunk. Yes, no. He couldn't even hit no. The fact of the matter is we are thinking outside the box. And God bless you all for being here to do that. It takes a lot of courage. Now, the problem with the standard of care in the war on cancer, we don't have to go into a lot of details. I'm sure you've heard that, but since Nixon, on December 23rd of 1971, since Nixon declared war, it's been abysmal. We know that 2% of all cancers respond to chemotherapy, and conventional chemotherapy hurts more than it helps. What we know is that the overall contribution of curative and adjunctive chemotherapy to 5-year survival in adults was estimated to be 2.3% in Australia, 2.1% in the US. 2.1% benefit by chemotherapy. This is the facts. This was published in the Clinical Oncology Journal. This is not alternative medicine. Chemotherapy makes only a minor contribution to cancer survival. I'm going to explain why that is today. Here's a name you should remember. Max Witcher, Distinguished Professor of Oncology, University of Michigan Comprehensive Cancer Center. Nothing alternative about Dr. Witcher. Nothing alternative. When Obama signed the stem cell bill, he gave the pen to Max Witcher. Max Witcher is on record as saying, chemo and radiation make your cancer worse. He also says the problem is when we treat cancer cells with chemotherapy, the cancer stem cells are being stimulated to grow too. Okay? Chemo and radiation unequivocally make your cancer worse. Now, but my tumor shrunk, says the patient. I took chemo and my tumor is half the size now, and the oncologist is pleased. The tumor shrunk. Well, Daniel Haber, director of Mass General Hospital's Cancer Center, says tumor shrinkage does not correlate with survival. These are troubling things to think about. This doesn't make an old doctor like me very popular. Because I'm one of the few certified instructors in insulin-potentiated chemotherapy. I'm one of the few doctors that can teach other doctors. But I've moved away from chemo because even low-dose targeted chemo is not your best option. The new target has to be the cancer stem cell. Our ultimate goal, says Dr. Cho at Stanford, is to come up with a therapy that knocks out cancer stem cells. That's not cancer tumor cells, that's cancer stem cells. Different critter. If you irradiate a tumor and kill a lot of it but leave the cancer stem cells behind, the tumor will grow back. You have to be thinking about cancer stem cells. Now that's not my topic. I've given prior lectures on this. I talked about that 2 years ago here. If you're not going to write these down, but you'll have access to it at weeksclinic.com. The references and the science is very clear. Prior lectures. I have also talked here in the past about V-venom therapy and apitherapy. What is apitherapy? V-venom therapy is a very powerful inflammatory agent and also an anti-inflammatory agent. It's both. You'll see that natural products have the yin and the yang, the inflammation and the anti-inflammation. A lot of references at weeksmd.com on V-venom and cancer. Here's a little reference to V-venom and prostate cancer. This was published 3 years ago. Basically, V-venom suppresses NF-kappa beta. It's an anti-inflammatory. It also stimulates the induction of apoptotic processes in cancer cells. So V-venom, very beneficial, very seldom talked about. Honey, may prevent recurring tumors. A lot of these studies don't happen in America. This happened in Turkey. Provocative study shows that using honey can prevent colon cancer coming back. All 30 mice treated with honey developed tumors. Without honey developed tumors compared to only 8. So again, a lot of things to do. We're not talking about that today. We're talking about unpleasant truths. So what about the old men? Why don't they get hired? At a job interview, the human resource manager says, "What's your greatest weakness?" And the old man says, "Honesty." And the resource manager says, "I don't think that's a weakness." The old guy says, "I don't give a shit what you think." So here you are. You are outside the box. You're learning something new today. So let's keep going here. We'll have some fun. The goals for this presentation is to clarify the dual roles of inflammation, to clarify the role of anti-inflammatory agents in corrective cancer care, and I'm going to share some protocols about the therapeutic effect of stimulating acute inflammation while suppressing chronic inflammation. What about inflammation? We now know that it's not just a painful joint. It's the driving factor behind the aging process. We now call it inflammation. It underlies all major degenerative diseases, cardiovascular disease. Here's the kicker. All cancer metastasis is driven by inflammation. We heard Dr. Contreras before say the primary tumor never kills anybody. You're mostly correct there. The primary tumor is not the problem. It's the metastatic tumors. Those are driven by inflammation. You'll see that Max Witchett and other doctors are saying, researchers in oncology, that the future of cancer treatment is anti-inflammatories. It's also a treatment for schizophrenia. This kind of shocked me. I'll come back to that, but inflammation drives all chronic illnesses. Russell Tracy, University of Vermont College of Medicine. Inflammatory factors predict virtually all bad outcomes. So I'm wanting you to work with me and agree that inflammation is bad, because in a minute I'm going to tell you that inflammation is good. So I'm going to have a little bit of a conversation, I hope. Psychiatric Times, January 2014, add anti-inflammatories to schizophrenic treatment. How amazing is that? These findings create a vision of the rational, adjunctive, anti-inflammatory therapy to quench the fire in schizophrenia. This is out of Harvard, anti-inflammatory agents in cancer care. If you interfere with inflammation, that is a new strategy to block breast cancer, self-renewal, and progression. So I'm not the only one saying anti-inflammatories. Now, what is inflammation? Let's think a minute. Inflammation is a symptom. And Hahnemann, Samuel Hahnemann, the father of homeopathy, says all symptoms are healing gestures. A fever for a child, that's very therapeutic. When I was on the cancer wards at Dartmouth, and I had to go, I was called at 2 in the morning to go give Mr. Jones triple antibiotics because he had cancer and he had a fever. I hated doing that. I felt like a Gestapo guard because I knew that that fellow having a fever at 3 in the morning on the cancer ward was his immune system kicking in and trying to fight the cancer. Don't go suppressing fevers. Too much of a fever will give you a Helen Keller, very tragic. Too much of any symptom can be problematic. But symptoms are healing gestures. Please hold on to that as a theme of this talk. Now, Hahnemann was a brilliant man. This is a picture of yours truly with the statue. It's almost one of my favorite places to be in Washington, D.C. So what are the benefits of inflammation? I've told you that inflammation is bad, it drives cancer. What are the benefits? Of course, you dilute the toxins because you have a lot of fluid coming in. You increase pain with inflammation. That limits motion, so you start to preserve the joint rather than destroy it. You get increased vascular permeability. The leakage allows for blister formation, coagulation of fibrinogen. White blood cells can muster to the area and create what's called a noble pus, beneficial. And most importantly, inflammation gives you interleukin 6 and interleukin 8, which what they do is they can go and they can recruit benign stem cells to come to the area of injured tissue, whether it's a broken bone or a gastric lesion. Inflammation recruits benign, uncommitted stem cells to come to the area of injury and to repair. If you're not familiar with that, that's critical. Cancer stem cells are bad. Regular stem cells are good. Regular stem cells are recruited to come to the area of injury by inflammation. So that's a beneficial thing. The problem is if you're giving chemo or radiation and injuring a tumor, it sends out that same SOS, and it recruits benign cells, stem cells, to come to the tumor and make what? Make more tumor. So a little bit of a fast transition, but work with me there. Inflammation brings uncommitted stem cells and makes them into cancer. If the tissue you're injuring with chemo or radiation is tumor, the stem cells will make more tumor. Lord Shiva the Destroyer. This is a beautiful process. In the Hindu religion, of course, Shiva is the destroyer, Brahma is the creator, and Vishnu is the preserver. Afterwards, Brahma again creates the world for new cycles. This is what happens in health. We need inflammation to break down systems so that we can then have regeneration. You don't get anabolic regeneration in healthy tissue unless you've had inflammation to destroy the tissue. It's the same with bones. So inflammation through the ages, this is kind of interesting. Hippocrates says it's a cooking process, and then there's a discharge and excretion. If I had more time, I would read all these slides. I'm not going to do that. I'm just going to give you a quick look at it. But Hippocrates valued inflammation. Celsus and Galen talked about inflammation being tremendously important. In the 1970s, even Virchow, our father of cellular pathology, said inflammation is a protective process. And yet you're hearing me say with one side of my mouth, inflammation is bad. Okay? So we have a question here. And so historically, inflammation was good. Cancer was helped by the fevers and the inflammation. But let's look, okay, now let's look at inflammation and cancer in the 19th century. Inflammations do not arise spontaneously, but they heal spontaneously. This is beautiful. Tumors arise spontaneously, but they do not heal spontaneously. It's kind of interesting. This is going to be a talk where you have to think with me. I'm apologizing about that. Inflammations do not arise spontaneously. It's because they're a symptom, a healing gesture. But they heal spontaneously if the body's healthy and nourished. Tumors arise spontaneously, but they do not heal unless you have the appropriate inflammation. Then Labov pointed out in 1896, you just don't get cancer if you have an inflammatory process happening. 1910, Schmidt showed that if you had childhood diseases with a lot of inflammation and febrile illnesses, you didn't get cancer. That's an active immune system. The destruction of the cancer by the cells of an inflammatory metabolism is clearly shown. This is Husman and Wolf. If anyone hasn't heard of anthroposophical medicine, that's a fountain of my knowledge base, Rudolf Steiner's work in medicine. The carcinomatous metabolism appears in just those places where the body is no longer capable of an active inflammation. The body is using inflammation to keep cancer down. Inflammation and cancer. In 72 leukemia patients, this doctor found that in the ones that had pneumonia, they didn't have the cancer. So what we have really, according to Wolf and Husman, is you have, in avoiding the problem, the cilia of infectious disease, we steer toward this of malignancy. So you've got these balances. Too much inflammation is bad, too little inflammation will get you cancer. But what's the modern view? The modern view is very different. The modern view is inflammation is bad and makes cancer worse. We have statements like Robert Weinberg, really the father of modern cancer work, says the connection between inflammation and cancer has moved to the center stage. We have in terms of asbestos work, they found that it's the role of inflammation which causes the asbestos-induced cancers. We found, according to Balkwick, that inflammation alone accelerates cancer proliferation. This is nice. Cancer researchers since 2007 understand and acknowledge that the fundamental prime cause of cancer is inflammation, not genetics. Inflammation and cancer, I'm kicking a dead horse here, but we're talking about, there's a growing body of evidence supporting the role of chronic inflammation with prostate carcinogenesis. So you need anti-inflammatories for the prostate. Here we see a lot of inflammation in cancer in terms of fish oil, which is supposed to be anti-inflammatory. We see no protective benefit for prostate cancer. That was very mystifying. Marine oil, it turns out to be highly inflammatory, therefore cancer-causing. Marine oil, fish oil capsules. No Patrick's in there. The consistency of these findings suggests that these fatty acids are involved in prostate cancer tumorigenesis. So we have to be cutting down on fish oil, increasing our seed oils. Now, it's worth reading this. While the genetic changes that occur within cancer cells themselves, such as activated oncogenes or dysfunctional tumor suppressors, are responsible for many aspects of cancer development, they are not sufficient. Oncogenes, not sufficient. Tumor promotion and progression are dependent upon ancillary processes provided by cells of the tumor environment that are not necessarily cancerous. It's an inflammatory process. So cancer is inflammation. It starts by inflammation, DNA damage, spreads by inflammation, breaking out, metastases, grows by inflammation, angiogenesis, and metastasizes with these interleukins. So anti-inflammatory agents are the treatment of the future. So I ask you, is inflammation helpful or is it harmful? Let's look a little more closely, because it's both good and bad, better or worse, depending upon, if you remember that symptom is a healing gesture, depending upon whether we're talking about chronic or acute inflammation. So if symptoms are healing gestures, I've argued in prior lectures that cancer itself is a symptom of a process which is not healthy. Cancer is not the disease. Cancer is the symptom of the disease. And I would suggest we consider the cancer itself as at least a warning signal, if not a healing gesture. We're going to look at chronic and acute. I'm going to propose that chronic inflammation is immunosuppressive and carcinogenic. Acute inflammation is immunostimulating and restorative. So how can we make the human organism able to have the appropriate inflammatory response? This is really beautiful literature. I'd like to read it all, but we don't have time. So I'll just say that they found that the inflammation found around the tumor is always chronic in nature and arises not primarily but as an insufficient reactive attempt by the organism to reincorporate the proliferating parts. Rudolf Steiner says, this attempt, however, must fail as long as the fever formation is inadequate, as long as you don't have enough acute inflammatory capacity. Fever formation, that is, so long as the ego and the etheric body do not engage in the metabolism and restructure of this unorganized cancerous life. For this engagement and structuring, especially on the part of the ego, a sense of appreciation, a sense of meaning in life, a sense of purpose are critically important to people with cancer. We know that. A lot of cancer patients today, I want to live until my son graduates from college in 5 years. They make it until then, and then they die. We need to have this ego organization. We must repeatedly emphasize the critical significance of warmth in undertaking cancer and its therapy. Warmth, by that he means enthusiasm, purpose, meaning.